how does birth trauma affect the mental health of women?
Yes, sir. Birth, especially, example, she had an episiotomy which was very painful, or she was not attended well by the health workers who were there, the midwives, during the delivery, or in fact even the gynecologist who was very anxious or rude to her, and didn't understand the pain and trauma that she went through. So there are lots of women who find that an extremely stressful experience, and that stress is so much that it leads to kind of a post-traumatic stress symptoms. She keeps on recalling that past pain, and that anxiety is so significant that it disturbs her sleep, her appetite, and she's restless, and she wants to avoid a second pregnancy. If she had, say, a difficult labor, she would rather say, I want a cesarean next time. Maybe I don't want to go through these labor pains because I didn't have a very, respectful delivery. So I think this is one thing where the obstetricians and their team has to be very careful. Ensuring the dignity of a lady during delivery is so important. Like in the West, you're allowed the husband to be with her and in the room, and she's provided a much better ambience, in fact. But in our setups, she hardly has privacy, even her during her labor. She has another 6 ladies in the government setup delivering at the same time, and she's being screamed upon when the labor pains are not progressing, or she's experiencing pain, and everybody is trying to do a PV on her. And suppose they're going again for a forceps delivery, and then untrained people are attending onto her. It's very, very traumatic. So that could prevent her, from going in for a second delivery. These issues have to be addressed, and she needs to be counseled and reassured. And her feelings have to be acknowledged that yes, we can understand what you've gone through. You didn't deserve this. This was a mistake on the part of the treating team. And once she's listened to, and she's reassured, that she would be getting a better place and a better reassurance, she comes out of it. So this has to be addressed. But if it's not addressed, she would just avoid a pregnancy. She would say, I don't want a second child because it has been so traumatic. So one has to address this issue. And many a times you require a good therapist to get her out of those post-traumatic symptoms. If they keep on relapsing and she keeps on thinking and she has bouts of recalling that event, then in some vulnerable patients, we even, not just therapy, we also add certain medications to calm her down if it has reached to that extent.
Dr. Prabha, if you could, I think we've had this, there was a discussion, I think, during the Masi conference about how birth trauma affects how a mother can care for her baby. Could you give us a little bit about, tell us a little bit about that, the effect of trauma on the mental health and of not just the mother, but her ability to bond with her baby thereon?
Yeah, I think, like I briefly mentioned in the past, and it's been sort of talked about by many people, multiple traumas, particularly sexual trauma, has a great impact. And we now discuss something called transgenerational transmission of trauma. That is, if a grandmother has had trauma, the grandmother transmits the effect of that trauma on the mother, and the mother then transmits that effect of the trauma on her baby. And so trauma is so important in terms of the kind of changes it makes to not just a person's mind, but to also what we call the DNA. There's something called epigenetic changes which happen, which kind of go transgenerationally. And that is why I think protecting people from trauma women from trauma is very important. Women who are traumatized tend to have anxiety, and they can find it very hard to bond with their baby. It could work both ways. Sometimes they're exceedingly cautious. So we've had a mother who would not let the baby out of sight, would not give the baby to anybody because she's so worried that something will happen to the baby or somebody will do something to the baby, because she's had such a bad childhood experience. So there's overprotection, or some mothers are just, it's so overwhelming to look after the baby that, like Shoiba mentioned, let somebody else look after this baby. And I think there are now several interventions which are being developed, which are what are called dyadic interventions, that we work both with the mother and the infant together to allow the mother to learn how to understand the baby's needs, to increase her sensitivity, to make her reflect on what is the baby trying to tell you right now, and what are you feeling, and maybe even acknowledging the anxiety that she goes through. And I think like what Sonia mentioned and the question that was asked about obstetric trauma, we find that moms who've gone through previous trauma and have had obstetric trauma, you know, when we think of obstetric trauma, we only think of the big things sometimes about episiotomy being done, or, you know, it being a difficult delivery, but sometimes just having a PV being done without her consent, clothes being taken off without her consent, without telling her what we are really doing. Sometimes small things like that can actually be extremely traumatic for women who've gone through past trauma. So I think you know, dealing with some of those things are important. And it really, we find that perinatal mental health actually has a new name now, and it's called mother-infant psychiatry or mother-infant mental health, because it has a large impact on that dyadic relationship. And some of the things that we do are, in addition to working with the mother separately, we also use videos as a method of giving feedback to the mom. So we you know, ask the mom to play with the baby as she would, take a 10-minute video and actually show her the video and say, okay, what do you think is happening here? What is the baby trying to tell you? Why did you look so anxious at this point? What made you so happy at this point? You're doing a great job here. How could you make this better? So I think just doing all of that is very important. So I want to tell people out there who are listening to us that there are many interventions that have been developed for these conditions, which are not only medication, but a lot of therapy. There are a lot of therapists available in the city, at least in Bangalore and other parts of the country. And we are hopefully going to bring out a list and a directory of moms, of practitioners, both obstetricians and psychiatrists and psychologists who work with perinatal mental health. So people who need help should actually access help. And I think that's what I would like to end with.